And I'm so excited to be officially joined by our next guest, Dr. LouAnn Woodward. You are the Vice Chancellor of Health Affairs and Dean of School of Medicine at UMMC. So thank you so much for joining us.
You're very welcome. Thank you for having me, and good morning. Good Monday morning.
Good morning. I forget to say that. You know, we've been here since 6:05, and there's, like you said, there's been a lot going on.
There's a buzz in the air. This is not a sleepy Monday morning. This is a very active, busy Monday morning already. That's great.
Right. Even if folks just need a jolt of energy, just pop on by.
That's
you know,
right.
There's men here too, not just my husband. There are other men here that are coming in and just checking out what's going on at the Women's Summit, meeting a lot of the really amazing, influential women of the state that have been brought together to network and discuss the issues that impact everyday citizens of Mississippi and families all the way from the local level on up. So we're glad you're here. Now, I have to tell you, my grandfather, he was a doctor. And he went to the University Medical Center. He served in Newton County back in the day, before they ever had a doctor out there. He was a part of a rural doctor program. So after Tulane, he went up to UMMC and then ended up out in Decatur, Mississippi, where they set up what's now the Newton County medical facilities out there. But
that is wonderful. That is wonderful.
It's well, and y'all are such a strong educational program, a presence. Y'all been in Jackson, and it continues to go and grow. So just tell us a little bit about, you've been at the helm now for a couple of years, and you've got many years into the future, hopefully. But just tell us a little bit about what has it been like and what is on the horizon.
So there's a lot of things going on. That's such a broad question.
Yeah.
I'm just going to, in my mind, since you started talking about, kind of medicine and medical school, I'm just going to kind of narrow it down to that track for just a minute.
Yeah.
And we, like so many others, are on the academic and fiscal year where July 1 is the start, June 30 is the end. So we're kind of in a place right now where it's sort of the beginning of the school year, like for so many other schools and colleges. And in fact, last week we welcomed our new class of medical students as well as dental students and a number of other students. Many of our schools, or a number of our schools, have classes that actually start in May. So honestly, all summer long, we're bringing in new nursing students, physical therapy, occupational therapy, kind of the whole gamut. But last week is when our first-year dental students and medical students came in. And, of course, it's such an exciting time.
Yeah.
They are all Mississippians. So our goal is that whether they end up in Newton, or whether they end up in Mendenhall or McGee or Corinth or wherever it is that they end up, that they do end up in Mississippi taking care of Mississippi patients. And kind of in the theme for today, I'll tell you that our entering class for medical school was 52% female.
Oh, wow.
And 48% male. That is kind of lining up with the national trend, honestly, right now, where it's at least 50-50, and in a lot of places a little more than 50% women, which is, again, sort of lines up with our theme for today. And I think it's very good and it's very exciting.
Yeah, it is. And I love the idea of educating, developing talent in Mississippi, and then finding ways to keep it here. People sometimes refer to it as the brain drain.
That's right.
It impacts every single industry, but I feel like it's especially the case in the medical industry. We really saw this, unfortunately, on full display during COVID, when a lot of our nurses especially, they could travel, and, you could make a good wage, but it pulled a lot of people out of the state. And so there is a residual gap you hear about a lot, especially in our medical facilities. So, what's the class size average of the new students coming in, and then what are some of the programs that are in place that help cultivate, obviously develop the knowledge and skills necessary, but to keep people attracted to staying in Mississippi?
So there are a number of things in that space. And it's not just the nurses and the nursing students and the nursing workforce where we see those gaps. Prior to the pandemic, when you look at physician workforce, Mississippi's last in physicians per capita if measured across the whole country. So physicians, nurses, respiratory therapists, physical therapists, there are so many areas where we have gaps in the workforce and needs in the workforce. So not all of our schools at the medical center, we've got 6 schools there, And then we also have the pharmacy students who are officially part of Ole Miss, but do part of their rotations with us. So sometimes we say 6.5 or 7, just depending.
That's, I've got an uncle and a cousin that have a pharmacy, and yeah, I remember them going. It's a big part of their life.
So we like to claim them, but
Yeah.
officially they're enrolled at Ole Miss. But anyway, so 6 or 7 health professional schools.
Yeah.
And not all of them have the same requirement as far as being in-state residents,
Mm-hmm.
but medicine and dentistry do. So for those 2 schools, we only take Mississippi residents. There are plenty other programs that give a great preference to Mississippi students and end up with mainly Mississippi students. But we do feel like if we have the applicant pool that is strong and vibrant and competitive, without going out of state, that is the right thing to do, is to take our students, train our students, and ultimately the people who are most likely to go back and practice in the rural parts of the state, so many areas where we have great need in Mississippi, are people who have some kind of connection. They have family there or a connection to that community. So to that end, we have a number of scholarships that are based on service, for practice. When you finish your training, that you will practice in certain places in Mississippi. We've got private scholarships that have that criteria, as well as the Mississippi Rural Physicians and Dental Scholarship Program, which the Mississippi Legislature supports and funds. And it has been in place now for 10 years or a little more. And that medical education is a very long pipeline.
Yeah.
So all of these different efforts will put us in a place that 15, 20 years from now, our workforce looks a little bit different.
Yeah.
It's just not the kind of program that you can start tomorrow and then see immediate results the day after tomorrow. It takes a little while.
Why can't we solve it right now?
Everybody wants a fast food order. I want I want it now, and I want it my way.
Yeah.
But it just takes a little bit of time.
Yeah.
But there are some really great efforts in place that are working and are already successful and will continue to be successful to retain some of our best talent in the state, because Lord only knows we need it.
Yeah,
we need it.
We do, and having that long-term vision from someone like you in the position you are, that's just so important to cultivating the talent and skills here in our state, but keeping it, because I want to stay here, and I know a lot of people that want to stay here. Yeah, let's keep it great. Let's make it even greater. Okay, let's shift really quick to your backstory.
Yes.
So, how did you get into medicine, and then what did you end up doing before you ended up as the the dean of UMC?
So I've been in this position now since 2015. I'm in my 10th year, which I just can't. It's one of those things I can't believe how fast the time has gone by. But I'm in my 10th year in this role, and I am a product of Mississippi and the medical center and the education programs there. So I started medical school in 1987. Finished in 91. I did my residency there at UMMC in emergency medicine, and for about 20 years practiced in the emergency department, the adult emergency department there at the medical center. And along the way, I was given wonderful opportunities by people who believed in me and people who supported me and people who allowed me, kind of took a chance on me and got into some of the education jobs, working with residents and working with students. And along the way, I learned that I love that almost as much as the medicine part. The opportunity to build things and to see something grow and know that, for example, if you can grow a class size in the medical school and if you can retain your residents to practice in your state, 20 years from now we'll be in a different place. And just the concept of how many patients that you can impact that way.
Yeah, that's a good way to think about it.
It's very appealing. So it was just sort of through opportunities that presented themselves along that way. I had great mentors, I had great supporters, and it's really been a fascinating career.
Well, it's wonderful to watch, and look, we thank you for being here, but we also thank you for your leadership at our medical center, for that vision you have, and who knows, I'm sure that there are some young medical professionals here looking to connect with the right person or to learn some more. So anyway, thank you so much for all of that work.
Thank you for having me.
It is so important.